So on the bottom of your screen, if you move your cursor over the bottom of your left-hand corner of your screen, you should see a microphone and a video. You can click on both of those to mute them and stop video or start video. And then if you scroll towards the middle of your screen, there is a chat box. And you can easily click on that chat box. And actually, I would like to ask all of you, because I do need to take attendance, if right now in that chat box, if you would go ahead and put in your full name and the hospital that, that you're working from, I think that will probably work the best. If by chance, and I don't think anyone is, but if by chance you are on by phone, please remember to mute your phone. But I can see everybody has joined, I think, through the computer. If not, let me know, okay? Oh, here's someone. Welcome, welcome, welcome. Hi, so someone's just joined, and let me do this real quick. 307-334-2711, can you hear me? Hello? All right. Well, we'll keep moving forward, and thank you guys for putting that into the chat box. That's probably the easiest thing to do. But you are welcome to, hi, yeah? Did somebody ask a question? See, it just says MCCLUJ, so is that Jody? Can you hear me? All right, let me look. All right, if you do have a question, just go ahead and put it in the chat box. That's probably going to be the easiest way for us to get started. You know, I'm going to just run over this again real fast, just because we've got just a couple more people that joined. Please remember to mute your phone. On the lower left-hand corner of it, if you scroll over the lower left-hand corner of your screen, you'll see two icons. One of them is a microphone and the other one is a video camera. So you can mute those, and if you're on by phone, mute them. Just another quick thing, you can left click, let me stop my video real quick. You can, I'm sorry, you can right click on your picture and you can write in your full name or your first name, and it will change it for us so that we can all see perhaps your full name. So let me put this back. I made that one a little different. And then moving on. Again, let me just go over on the bottom of your screen. You should see a little chat icon, and that's how you open up the chat box. And if you would use that, please, to ask any questions, leave any comments, and also if you would take just a minute to type in your name and where you're from, I would greatly appreciate that. And if there's any veterans on the phone today, again, I want to thank you, and I know we all do. We want to thank you for your service to our country. Thank you. I think I've got attendance. So we're going to go ahead and get started. Lillian Zuniga is a graduate of Worland High School and the University of Wyoming. She has been the manager of the Wyoming Department of Health Office of Health Equity for almost 8 years now. Lily and I in the Wyoming Flex program and the Office of Health Equity have a vision for health equity around Wyoming, and we have a passion for reducing disparities in health. So if you will, please welcome Lillian Zuniga. Go ahead, Lil. And if by chance you can't hear us or see us, just type it in the chat box.
Sure, good one. Good morning, everyone, and thank you for attending. I'm grateful to be here today, and thank Kyle for having me. And I'd like to share with you my office mission is to minimize health disparities in Wyoming. And some of you have seen my health disparity report that we put out in 2012. We are updating that, and so there will be some new data, so you'll be able to look at when you're working on disparities in the state. And I think Kyle this is the first of 6 series on Tidbits. So I'm hoping that we are looking at different subjects. I think that one topic is on microaggressions, and there's implicit bias. We're looking at the determinants of health. So we have lots of topics that we're looking at. So, and the objectives for today is to define cultural competency in healthcare, introduce the Office of Minority Health Enhanced National CLAS Standards, and just to give an overview of the language access services. And I have 3 poll questions that Kyle's going to help me with. She'll put those up for us. Do I need to not share my screen, Kyle? Although you got it. Okay, so if you could answer these 3 questions. Do you have a language access plan at your hospital? Yes or no? And if yes, what format does the plan have? Multiple choice? Do you do face-to-face interpreting, telephonics, other, or none? And also the 3rd question is there a designated person or persons overseeing your language access plan? Are the polling questions live? Can we see them as they go, or is it something we have to wait till everyone's done? Kyle, you're on mute.
Thanks, Lily. We are at 12 of 15 people completing, so we're about at 80%. If you can't see the poll, let me know. Just put it in the chat box or unmute your phone and let me know that you can't see the poll. All right, Lily, I'm going to go ahead and end polling, if that's okay with you.
Yep, that's good.
All right. And those are the results. Can you see them?
Okay, nice, yeah. So we have 75% of the people said yes. And then the next question was yes, what format? Face-to-face, telephonic, and other. Does anyone want to share what they're doing, what some of the, if they have a staff member on that's doing their interpreting, and can you guys, I can't see anyone, but if you can unmute yourself and kind of share with some of us some of about your language access plan. Anyone want to share what they're doing?
This is Ann from Platte County Memorial Hospital. In addition, we have one person who is on staff, so when she is available, she is certified as a Spanish medical interpreter. But one of the primary things that we use is our video remote interpreting. So it is a dedicated computer screen with that you just touch the screen and it gives you a choice of languages, and then a person comes on, so that it's almost like being able to, so you have the ability then to see facial expressions expressions. The interpreter has the ability to see facial expressions as well as the language.
Great, that's great. Thanks for sharing. That's what we use a lot of in our off sites, like the public health nurses. There's a few sites that have face-to-face, but you know, interpreters are you know, hard to come by. So this last year we had 3 classes in the state to train interpreters and on professionally. So when they got done, they got their certificate. But it was very intense, 40 hours, and we're hoping to do a 2-day training this following year on medical interpreting. So keep your eye out if you have staff that you'd like to get trained. That's something that we are doing hopefully next year, 2018. Okay, let's go on to our next. Okay, I wanted to share with you a tool that I've, through the Office of Minority Health and partnering with CMS and another, I believe it's University of, I believe it's Wisconsin. I'm not sure what university, sorry about that. But this is a great tool to look at the disparities in your community. You can go do it at a state level and as county level, and you're able to pick and see like the hospital emergency visits, who's, you know, if you even breaks down through race and ethnicity, so that way you can, you know, focus in on how you could work better cross-culturally with all your clients that are coming in, or how can you do outreach to you know, your diabetic clients, and how can you, so that's, you know, this is a great tool. It's the, you'll see that the link is on the bottom, so I highly recommend it. It's just one tool they just came out with. And so looking at the data from this study was in 2013 on disparities and diversity. And here's some disparities that they brought up and this study, and one of them was in 2010. By 2015, you'll see that the majority, the demographic changes in 54% of the minorities will be the majorities. And also, if you look at the increasing cultural competency training, that has increased from 2011 survey to 2013 and to 86%. And another question I have, if anyone would like to, what kind of cultural competency trainings do you guys have in place in your organization? Do you guys have web-based, or do you guys bring in presenters and do a 3-day training, or does anyone want to share what they're doing as far as training goes in your hospitals on cultural competency?
Okay, just a reminder, if you want to say something, to unmute yourself, which is what I've done twice now.
I was wanting to see what kind of trainings out there, because it's different everywhere. And I know a couple of, I think in 2013 was the last time that we, the state, I had a state partnership grant through the Office of Minority Health, and we did a lot of cultural competency trainings, and they were 8-hour trainings, and we went to different parts of the state for about 3 years, but then that grant ended. And so it's just wondering if anyone was doing any sort of cultural competency training in their hospitals among staff. And so that's, you know, the people are doing it, but I just kind of wanted to see how they were doing it in this study. And I know here at the Department of Health, we have mandated health equity training for new employees, and we are now having our staff have a goal in their PMIs in order to, move forward in health equity. So it's a priority in our strategic plan. And so with the next, the increasing the cultural competency training, there's also the difference between diversity training and cultural competency training. Diversity training was done more in the 80s, and there's where they got, where they were training on race and ethnicity training, like here working with the Native Americans, this is what you'll see, and working with African Americans, this is what you'll see. But what they found, and it's changing, the training has been changing, is that it's becoming more inward focused. So now they're looking at how are we as a provider, as front desk working, how is that affecting how I am working cross-culturally with people that come to my service, because and that's what we're going to learn in our next webinars that we do. We'll be able to look at some of that and how that really plays a big part on the new way that they're training cultural competency. And so another way that they look at in cultural competency and working towards health equity is the need for leadership diversity. And this one, they're saying that this needs work, because if you have hospital boards, look at your hospital, how much diversity is on the board. And again, executive leadership, and it could be, I'm not just talking about race and ethnicity, I'm talking about women, age, there's different things to look at when you're looking at diversity. And so the next one is working with diverse patients, and that has collecting feedback from diverse patient population. And this is very important when we're looking at the CLAS standards. That's one of getting input, engaging your community. And the other important part is we're hoping that with this, at the end of this webinar, Kyle will be able to let you know of some resources that you'll be able to translate some documents. So that's something that you can look at. And then another important is when you're collecting the data on a, and then that's the real data where you're looking at race, ethnicity, and primary language. And so that's important when you're working with cross-culturally, so that way when you are doing your discharge, the person is understanding you completely when you are discharging it. So those are some of the things to look at in that study. Okay, so now we're going to look at cultural competency definition. It's a lifelong process because we are constantly changing. People in our policies change, staff turnover change, working communities change, so that it's constantly changing. So we have to re-examine and examine our values in our beliefs in our organizations, in our hospitals, and how are we making that more engaging for our clients that are coming in, and develop and apply an inclusive approach to health care practice, and to recognize the content and complexity of provider and patient interaction, and to look and to preserve the dignity of the individual families and communities. So that, and the reason why we say it's a lifelong process, because we're all different. We all are constantly, things are constantly changing, and there's so much to address cultural competency. Like the low-hanging fruit right now is to have that language access plan in place. But once that's done, you can go on to something else and build a different domain in your hospital. So here's the Commonwealth Fund definition, the ability of systems to provide care to patients with diverse values, beliefs, and behaviors, including tailoring the delivery of care to meet patients' social, cultural, and linguistic needs. The ultimate goal is it is a healthcare system and workplace that delivers the highest quality of care to every patient, regardless of race, ethnicity, cultural background, language proficiency, literacy, age, gender, sex or sexual orientation, disability, religion, and social economic status. So that was long, and it's because that's why cultural competency is a lifelong learning process. It's a journey with no end. So some of the reasons for rationalizing why we wanted healthcare is the response of our demographic changes, and of course to eliminate health care disparities and to improve the quality of services and outcomes. And there's a lot of accreditations and regulatory and legislative means for this as well. And I will cover some of those. And gain a competitive edge in marketplace. With the new changes, there's going to be, a market for more cultural diversity and buying power. So that's something to look at as well. And the decrease of the likelihood of liabilities and malpractice claims. And here's a framework that I'm using here at the Department of Health to kind of, it's a visual to kind of give me, how to build the cultural competency infrastructure and development. And first would start with your cultural competency definition. We have one here that we developed at this in the public health division. We also did an inclusive and a diversity definition as well. And so those are some of the foundations that you want to start. So everybody's on the same language, everybody understands where you're going. And then we also, with our strategic underlying plan that we have, we developed a cultural competency diversity committee, which we call the HUE. We call it HUE, which stands for Health Equity Work Group. And that group puts on monthly webinars or HUE Talks, that's what we call them. And we're finishing our 12th one this next month on the 13th of December. And that is televised live. So if you'd like to join us, Kyle can give you that information. And it's just great information. The more knowledge you have, the better you can serve the diverse populations that you serve. And so that's that HUE group also oversees the language access plan. So that kind of updating that as well. So then we'll, with this infrastructure, you'll develop indicators on cultural competency. And, one could be that you're going to complete your language access plan and train on that as well, because it's very important to have that. And once again, it's in your strategic plan. Once you finish something, you'll probably move on to the next thing, and just keep checking to see if your evaluation is, organization is moving forward. And also very important is the staff training and development. So I feel that that is very important on moving the needle on health equity and taking care of the disparities. So this is just around about steps on infrastructure and development with cultural competency. And so here's some of the recommended and organizational cultural competency. These are some things that you want to see, that you define a set of values and principles and demonstrate the behaviors, attitudes, and policies and infrastructures, and value diversity, conduct self-assessments, and that's one thing I didn't mention that the HUE group also does. We have, we call it the HEAT, which stands for Health Equity Assessment Tool, and we gave that to all our program managers, and kind of gives us, you know, what direction to go. And some of them wanted training on social determinants of health and lots of tribal you know, government training, and so those are kind of helped us guide our training for our staff, our workforce training. And we also manage the dynamic differences and to acquire the institutionalized cultural knowledge and adapt to diversity and cultural contents of communities that organizations serve. And I will talk a little bit about that when we're doing our language access plan, or when we're talking about that, because it's important that you know who you're serving in your community, and to be able to tailor the service to that person, and incorporate policies in administration, service delivery, and have a systematically involved community. And one of, I feel, when I talk about the CLAS standards, the most important thing I think is the governance and leadership, because they're the, if you're the one that will be moving this forward, because you're going to be putting money into your services that, you know, like language access plan, and that's so here are some of the standards for accreditation requirements. And with the Office of Minority Health, they have the National CLAS Standards for Linguistic and Appropriate Services in Health and Healthcare. And I'm going to kind of just give you a little highlight on that. And the Joint Commission also, and the National Committee on Quality Assurance, and the National Quality Forum. And the last two are medical schools. They're now, for accreditation, they're looking at adding cultural competency into their school as well. So when we're looking at the CLAS standards, looking at it enhances or advances health equity, improves quality, and helps to eliminate health care disparities by providing a blueprint to implement cultural and linguistic appropriate services. And I'm going to give you a link. You can also download it there on that link, and it kind of gives you so you can customize it to your own hospital, because each medical office will need to customize it to their own, because it's because everyone's so different, and so it may not need as much in some area as you would the other. But the CLAS standards were in 2002 is when they first came out, and then they started updating them in 2010, and now in 2013 they came out with the National CLAS Standards Enhancement, and that was to cover some of the other areas that they weren't covering in the 2000 version. So those CLAS standards there are 15 of them, and there's one overarching standard principle, and the other three that you see are themes. But the first one is to provide effective, equitable, understandable, and respectful quality care and services that are responsive to a diverse cultural health. Okay, let me start over. Okay, provide effective, equitable, understandable, and respectful quality care and services that are responsive to a diverse cultural health beliefs and practices, prefer language, health literacy, and other communication skills. So with that one being overarching, so when you're looking at the next one, which is the governance, leadership, and workforce, that is, you can have a whole workforce education on that first principle because there's so many things to learn from that, and to be able to be a leader to move this forward. It takes, in some places, you're going against the grain. So, you've got to just keep pushing and keep moving it forward. It's not, you have to have buy-in from everyone, and it usually works from the top down, but hopefully you have some people working from the bottom up as well. And so the next piece we'll be concentrating on more from the communication and language assistance, and that one we'll be talking a little bit more about later in the presentation, and engaging continuous improvement and accountability. So it's always good to have those patient surveys and to check back and to let people know that you are doing the class, participating in class standards, so that they know that you are taking part of that. And so this is the blueprint that I was talking about implementing, and how you can go download it there on the bottom. It's available on the Minority Health Think Cultural Health website. So when you're looking at all the interactions for effective communications, you're starting off with the outreach and you're ending off with the after visit. So all of these different encounters that we have with clients, and when you're out there doing your marketing, you want to make sure that your documents are translated, and if you have a high population that needs the documents translated. And when you're marketing, use some of the people that are in your community that reflect, so if you're advertising something and that you have 20% Hispanics in your community, try to be inclusive in your advertising and marketing. And then once again, when people come to the counter to make the to do the scheduling, have the cultural competency skills, be able to address the high needs of people from diverse backgrounds. But if you had someone with a mental health issue and they were hard to schedule, got to learn how to work with everyone that comes up. So there's some a mental health training for cultural competency. There's all kinds of work, all different LGBTQ but then what I'm talking about. So with that, when you're scheduling with that, or even with religion, to know the people that you're scheduling, to know do they prefer a male or female. And so when you just keep going down the line with all the interactions that people have with the organization, it's just good to be able to, even when you're taking the data, this is important, and that was part of the class standards. That's one of the recommendations, is to collect data. And when your front desk people are asking what is the race and ethnicity, they need to be able to ask, so that way when you're gathering that information, you have good, accurate information. Because I know a lot of times when I go to a place, the people behind will automatically assume that I'm a certain race, and they got it wrong just because of the surname. They think that because you have Hispanic last name, or you're Hispanic, and that's the same with the Native Americans, because a lot have Spanish last names. So I have a video I wanted to show to kind of get us started on language access piece. So Kyle, do I just press in and it'll pop up? Or can I?
I think so, Lily. Let's give it a shot. It should work.
Okay, here we go.
And if you can't see it or hear it, let me know.
Okay, it looks like it came up. Good deal.
Lily, while we're waiting for that, we do have a question in the chat box about whether or not these slides will be made available after the presentation.
Yes, Kyle can send them out, or when she puts this presentation on the website, maybe she'll put the slides underneath it, because
Sure.
I think you need it's easier just to click on the links that I have all on there. So yes. And I don't know if it sounded like it was working when it was small.
You know what? You might want to just stop sharing your screen for a second.
Oh,
And then,
there it's going.
right. And now share your screen again.
I didn't stop sharing it. I didn't get that far.
It's no longer on my screen.
Okay.
I am not seeing anything at this moment.
Okay. My share screen disappeared. I don't know where it went.
Try now.
Oops.
I apologize, you guys. This should work.
Let me put this down and see. So, share screen. What's this one?
I apologize again for the technical difficulty. Okay,
Is it
it's
working?
up. Yes.
Okay.
Make it big.
Okay, let's try it now. Yeah.
There you go. Lily, I'm not hearing anything. You know what? Can you stop sharing for just a second? You need to completely stop sharing. And on the bottom of your screen, when you do hit shared screen, when the box comes up, you need to click on the little thing that says share audio.
Okay, so share screen.
And is there a little box by it that says share audio, share video?
No, I don't see it.
Just 1 second, you guys. And I apologize. We'll be right there. Lee, I have another idea. Why don't you go ahead and go to your next slide, and I will see if I can get it up on my screen.
Okay, sounds great.
Okay. You want to go ahead and go to your next? Okay, good.
Yeah, you can see my screen still up. Okay, so go ahead, Kyle, take it away.
Well, go to your next screen.
This is the video, okay?
Okay, and so what's the name of that video, and I'll see if I can find it.
It's on. You can't get into my slide and look at it by chance, because it's on the bottom of the video.
Let me try.
So if you can move my slides, you should be able to.
No.
You can't.
I'll see if I can find it. You move on to your next.
Okay.
Next.
Okay. Okay. So this next slide is about the languages in Wyoming, and there's out of all the population, 77% are limited English proficient individuals. And then when you look at it in each county, there's 4 counties, possibly 5, that have high percentages in Spanish speaking. Some are Chinese, and it looks like we look at Laramie County, you have 15% Chinese. So when you can go to I might have put the at the end for the resources, if you're curious about what you can narrow in on your county, and you can gather that data as well. And so this is important information, so that way, I know they have a formula for Office for Civil Rights for you to look at. If you have so many people in your community, you should have your documents translated into that language. But if you do have extra funds and would like to, with Kyle funding that she may have available, you can get because you never know who's going to be driving through town. We're so rural in Wyoming, and if someone's coming to your hospital and they're Spanish speaking and you don't have your forms translated, you know, this is a good thing to be able to have your documents and your discharge papers translated. And it's, once you do it, it's just the maintenance. The cost is lower each year. It may be upfront a lot of money, but after that it's a lot less. So.
Lily, I think I can do it, but I need you to stop sharing your screen.
Okay, done.
Can you guys hear it? Can you hear it?
Mm-mm. I can't.
You cannot?
Mm-mm.
One more chance here.
Doctor on that too. That's Tandoro.
Excuse me, sir. I'm so sorry.
Attendi bien done.
She's been crying nonstop. She has a temperature of 105. I don't know what to do.
Marabidig. Vi paroles
No,
lasant.
please. Just every time I feed her, she throws up. I don't know.
Vi paroles
I don't understand
lasant.
what you're saying. What are you saying? Can you just look at her? No, she's burning up. Just feel.
Faju paroles la anglan.
No, what?
Povas ma grandan mezloĝenan.
She's burning up. Feel her head.
Tranquilli, Kananche. Demande is Askan.
What is he doing?
Do you have?
My baby, she's got a temperature of 105. Every time I feed her, she throws up. Please, can you?
Neskile vortem paraskula.
She's burning up. Feel her head.
Morabidig.
Please, just feel her head.
Povas kompreni.
Feel her head. Just someone let me in to see the doctor. No, does anyone understand what I'm saying? Please, someone help me.
8% of U.S. citizens speak limited English. For these 25 million Americans, professional interpreters can mean the difference between life and death.
Lily, it's back to you.
Okay, thanks. So, does anyone want to share anything that they've, take away from the video? Share my screen again. No? This has been around for a while, so I'm sure that you've seen it around already, but every time I see it, it still gets to me. This could happen in your hospitals, you just never know, and there's a lot of training. If you go to the website, I believe I put it on the back of the resources, but there's some training modules that you could use in your organization for training on language access, and there's some great videos there that you can use. So a limited English proficient individual or person is a person who speaks is not able to speak English, read or write, and understand English well enough to allow him or her to interact effectively with service providers. And some people, they say they speak English well, but they'll always nod their head. So you kind of have to really see where that person is. And they feel comfortable sometimes reading more in their native language. So that's also, when you're collecting data, a question you can ask: do you prefer to receive your documents in their preferred language? So a lot of, I hear when doing my trainings is people get confused with an interpreter and a translator. And an interpreter is someone who converts an oral or sign language or message from one language to another. And so that's the oral part, the talking part. And a translator is someone who converts a written text into another language in writing. So whenever you're referring to someone and you go, I need a translator, you need a person that's going to translate your document. So I hear that confusion a lot, and I have a story about the training for the interpreter training. The trainer had a bell in front of the training room, and then every time someone said translator, she would ding it, and so everybody would wake up. And so at the end, they stopped calling interpreters translators. So it just helped. So, you know, some of the being in compliance with the Office for Civil Rights, the Title VI of the Civil Rights has that you're obligated, if you even have $1 of federal funds, to have an interpreter available to your clients at your cost, not theirs. So just keep that in mind. And when it looks at national origin, that's the language piece. So spoken language is considered an alternative for the national origin. And some of the other compliance pieces would be their American Disability Act. And with the Affordable Care Act, there's a section 1559. It's the non-discrimination. And this, I have a video on here, but Kyle, I don't know, we're running close on time. It's about 2 minutes. Do you want to cue it up? See if I can?
Why don't you see if you can?
Okay.
If somebody's talking, I can't hear it.
Do they not hear it?
I couldn't hear it. So we will need to, let me see.
Here, Kyle, I'm going to copy it and I'm going to send it to you via email.
Okay.
And I think that'd be the quickest way, so you don't have to Google it, because it might take a while, but at least we'll have it up. But this video is kind of giving an overview of all the requirements for that 1553, 1557 Affordable Care Act. And one of them is that you should have a clause on all your documents that you send out. And there's a list of what documents they are. And so if you want more information, there's you can Google the ACA section 1557, and you'll need to know how many languages are, because you have to post on your main website you'll need to post that clause in all those different languages, the non-discrimination clause. And so this video that I'm showing you is going to talk a little bit about what it is, and it'll give you some tips on what you need to do. And so once again, I put that in the reference as well in the back. But I highly recommend, if you don't have that clause on your front web page of your hospital, to please look into that. So you could be in compliance, because it's also you have to sign a paper saying that you're in compliance. So are you ready, Kyle?
I am. Just need you
Okay.
to stop sharing. I appreciate all of you guys being patient with us as we work out our technical difficulties. Can you hear it? Can you hear it?
I can.
Say, does the Affordable Care Act, Section 1557, and its final rule have you scratching your head? Here we'll explain how to comply and meet the communication needs of plan members who are blind or have low vision. Section 1557, the non-discrimination provision of the Affordable Care Act, has been in effect since 2010. The Department of Health and Human Services issued its final rule in May 2016, and it went into effect July of the same year. Its purpose? To inform individuals about their rights and covered entities about their legal obligations. What's defined as a covered entity? Healthcare programs paid for in part or administered by the Department of Health and Human Services, and federally facilitated and state-based health insurance marketplaces. To comply with the final rule as it pertains to meeting the communication needs of individuals with disabilities, here's what you must do. Provide auxiliary aids and services, including audio recordings, as well as Braille and large print materials. Ensure electronic and information technology is accessible. Use non-discriminatory marketing practices, and make reasonable changes to policies, practices, and procedures to provide equal access. To ensure compliance, keep these dates in mind. By October 16, 2016, draft a notice of individuals' rights under Section 1557 and post it conspicuously in your office, on your website, and in significant publications and communications. By first plan year beginning January 1st, 2017, ensure applicable health insurance and group benefit designs comply with Section 1557. Have questions about how to comply with Section 1557 as it pertains to communicating with plan members who are blind or have low vision? Give us a shout. We are your go-to expert for alternate formats.
Sorry,
Braille,
Kyle, can you stop
large
it right
print,
there?
free flows,
Can you stop it?
accessible
Because
PDF, e-text, and audio.
that way it's not advertising. I just wanted to get the education piece on there, not to promote the people that are that put it together. So
All right, let me stop share. Sorry, guys. All right, Lily, you should have the screen again.
okay, I'm going to see if I can find it because it keeps getting lost on me every time I. So, let's see. The next slide, I'm probably not sharing, right, Kyle? Because
Hold on, my bad. Okay, now try.
okay. I think I have to do and slideshow. Go back here. Find my screen share. Okay. Back. So this next slide is about the implementing your language access plan. And
Can you make your screen big again for us?
Yes. Okay. So you're implementing your language access service plan, and we actually have a contract that we put in place in July 2016 with Tel Language, and they do our face-to-face, they do our telephonics, they also do our sign language with a program called Blue. So we have something in place as well, and we're working on building our face-to-face interpreters, and I have a list of interpreters that went through my training last year that are interested in doing statewide face-to-face interpreting. So once I have that list, I could share that with Kyle, and Kyle can send that out to you all as well. So that way, if you ever do need a face-to-face interpreter for some of those clients that are elderly or the young children that have a hard time getting on the phone or even talking into a computer, that we have that available, and we're still building that infrastructure for interpreters. So hopefully you have a designated person to contact that will do the training on on your language access plan, and work and have your procedures in place, and making sure that the policies are also in place. And there are lots of information on the lep.gov website that you can go and download I speak cards, and so there's a lot of material that you can have available when you're putting together your language access plan. So some of the protocols for your interpreting is do telephone, face-to-face, sign language, and relay services, which are free in Wyoming. And interpreting guidelines, you want to have advertisements in your office. So if you have restrooms and you know you have 20% Hispanic in your community that are LEP, I would suggest that you put signs up and determine the services that are needed, and speak slowly and clearly when you're interpreting. And there's when you're interpreting, you want to speak directly to the client, not to your interpreter, and so that you've building that rapport with the client. And record when. And one thing too, if you're doing telephonic, you want to make sure that you're getting the name of the person that's on the other end of the call, because sometimes their speakers not working and you can't hear. So that way you have a record of that. And then once again, translation is written. You need to have most of your or all of your documents translated into probably Spanish, because that's the highest language in Wyoming. And once again, when you're sending them off to the translator, and as Kyle's helping you do that, you want to make sure it's in a Word document and not a PDF, because they'll charge you extra for that. And once determine your target audience and the language literacy level, you should have everything translated, or even all the materials you're sending out at a third to fifth grade level, and 8th grade at the highest. And interpreting policies, again, look at the patient's hard of hearing, and it should be free to them. And interpreter service must be provided by a trained, qualified interpreter. You do not want to use family and friends, because sometimes they have, they don't want to interpret something if that's, are sensitive. And plus, it's a HIPAA compliant as well, because you just never know if they're going to turn around and tell their friend that they were at the doctor with their friend, and she was diagnosed with something, and her friend didn't want that shared with anyone else. And once again, never ever use minor children. They should never be used, just because it puts them in an awkward position, and if it came back, it'll be something against you as using the children. So benefits of the service, responding to the demographic changes, reduce health disparities, improve the quality of service and outcomes, and meet the legislative and regulatory and accreditation requirements, gain a competitive edge in the marketplace, and decrease the risk of liability and malpractice. And here again is my website. I need to update that some and add the list of interpreters, but there is a lot of materials there that you can go to and get how to purchase an interpreter service, and how to purchase translation services, and there's even cards, the I Speak cards, that you could possibly download on there as well, or a link to them. But I think that's all I have for today. Here's my contact information, and once again, these slides will be available to you via Kyle. So do we have any more questions?
And if you do want to talk, just remember to do what I don't do, which is unmute yourself. If you have any comments, please feel free to type them into the chat box, and we can do that too. On my end, all participants are unmuted, so if you need to speak, you have to unmute yourself. again, if you have any, is somebody there? Is it just me? Okay. If you have any questions, any comments, any other information that you would like to have available to you, contact me, or by all means contact Lily too. Hello? Okay, so again, just contact either one of us if you have any questions about the presentation today. And then Lily mentioned something, so really quickly I'll just go over that, and that is what money is available and what for. So I just recently heard from HRSA because I thought flex funds could be used to translate your documents, and they cannot be used for that. So maybe SHIP dollars can be used. I can further that information. Flex dollars can be used for interpreter training. So if you have somebody at your facility that you want trained as an interpreter, contact me and we'll get that whole thing started. We'll probably send them to Lily's next training. And if you would like to bring some diversity or some cultural competency training to your facility, contact me again, because we can work with you on that to determine how we can best do that for you all. I do have 2 quick poll questions. If you don't mind, let me close that one out and see if I can launch my other poll. And if I can't, then we'll just close the polling. And thank you again for coming. And if there's no other questions or concerns, I'm gonna let you go. Have a great Friday. Thanks for coming.